Hello, everyone. Welcome to Lakewood Health System's Be Well Videocast. My name is Matt Jensen, Director of Marketing at Lakewood Health System. Today, we're going to be talking about rehabilitation services at Lakewood. What services are being offered right now? We are open. We are seeing patients. So we want to talk a little bit about that. We also want to discuss just some of the safety precautions that are in place, and then also what a patient can expect when they come in for a visit during this COVID-19 pandemic. And here today to talk to me about all of this and joining me from Lakewood is physical therapist Claire Grunewald. Claire, thanks so much for joining me today. It's great to have you with me.
Thanks, Matt. It's great to be with you.
All right, perfect. First question for you today, Claire. So I think first and foremost, we just wanted to stress, and I know this is something you wanted to talk about today too, that you are in fact seeing patients at Lakewood. You guys are open, you're busy seeing patients, and have been now for some time. So can you give us a little bit of an overview of the types of services being offered right now at Lakewood? Are there any limitations because of the pandemic that's going on right now? And then also talk a little bit about what can a patient expect when they come in for a visit right now, in terms of safety precautions, and what sort of steps are you taking right now to ensure patients are safe?
Yeah, absolutely. Yeah, just like you said, we are open. We are still seeing patients. We provide a full range of rehab services with our patients, including speech, occupational, and physical therapy. We see a variety of conditions, including those with dizziness or vertigo, those that have balance issues or are at a fall risk, and just those that are having new or chronic onset of pain. Our occupational and physical therapists can see you for that. We also see pediatrics with occupational physical therapy and speech therapy as well. We do have a number of safety precautions in place just because of the COVID pandemic. All patients and staff are screened at the door, including asking for any symptoms. You will receive a mask that you'll wear the entire time that you're in any Lakewood setting. Your therapist will have a mask on as well as goggles too, make sure that you are safe and they are safe as well. In addition, we have a thorough cleaning process throughout our Lakewood Health System and in our department in our rehab therapy service. So feel safe and secure that we are making sure everything is clean. If we use a piece of equipment, it will get wiped down immediately after we are done with it, so it's ready for the next patient.
All right, fantastic. So many of the same precautions that we're taking, actually very much the same precautions that we're taking at the clinic right now too, with all of the screening and making sure that folks, if they are symptomatic, those types of things, making sure we have a very thorough understanding of that. So thank you. Next up, wanted to talk a little bit about one of the options that's a little bit new, I guess, in terms of in the rehab world, and certainly it was a very welcome addition to the clinic setting as well, is virtual video visits. So tell us a little bit about this. They are available. I understand at Lakewood we can do them. There may be some limitations in terms of insurance, but I also wanted to just talk to us a little bit about that. What does that process look like if a patient has never gone through one of those? And maybe just kind of tell us a little bit more about that.
Yeah, that's exactly it. So it's a new and welcome addition to our therapy services. Video visits are dependent on your insurance. So if that's something you're considering that you'd like to do, you can always call our rehab department. We can look into it for you with your insurance. Just like coming in for a regular visit, we would need doctor's orders for that. Some really good benefits to doing a home video visit through your phone or your laptop is that we can really see what your setup looks like at home. Are you struggling with reaching into the cupboard? Are you struggling getting up off the couch? Do you have some weakness or shoulder pain that limits you from doing your day-to-day activity? And we can look at that home setup and go, hey, how about we change this? Or how about we use this part for an exercise program? And get you really set up at home. One limitation with that, though, is we can't do any hands-on therapy or really feel or assess those muscles or those joints. But we do a thorough assessment of looking at your description of what your pain is like or your limitations in your movement or motion, and then come up with a good game plan for both you and the therapist as far as what works, time frame that works for you to see us for visits, and then go through any questions that you may have. It's really easy to set up an appointment through that. We just work with the front desk. They would send you an email link that you'd click on, and at the appropriate time of your appointment, we would click on that and then meet face-to-face through either your laptop or your phone.
Perfect. So no real concerns about the technology out there. Don't need to be afraid of that. This is something that we can make fairly seamless for you and fairly simple. So great information today, Claire, it's been great to have you with us. I think, again, we just want to stress for all the folks out there that rehab services are available at Lakewood Health System. They have been now for a couple of months, and very busy and active. And so thank you for spending some time with me today and laying that out for some of our patients.
Thanks, Matt. Happy to be with you today.
All right, perfect. Thank you, Claire, again, and thank you to all of our listeners. Everyone have a wonderful day out there.